What's going on, everyone? Happy Thursday. Happy Halloween to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, a flu test, or a test for anything else, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Virus Update for Thursday, October 31st, 2024. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all things COVID and all those other viruses that could be a health threat to you. Of course, we do give you various different news stories each day, data, wastewater. Today we're going to take a look at wastewater. Wastewater is getting rather interesting for several viruses. We're also going to take a look at the Pennsylvania update, an update from the UK, an observation of mine from this morning, which is, not so good. It really shows that there may be a lot of people dealing with post-COVID issues from that summer surge. We have some new case numbers in. We have some more states that have come in today. So we do have quite a few things to get to. If you're new to my channel, hit that subscribe button down below. Give this a thumbs up. Hit that notification bell. Share this video with anyone you know and leave your comments down below. First off, before we start, I have to give you an update on something that I mentioned yesterday. My dad was sick. Still is today, but he is doing much better. Still a bit congested, still runny nose, coughing. He's taken another COVID test yet again, negative, and I took one too just to be on the safe side because I was rather congested yesterday, which is normal for me post 2020 COVID infection. I do get quite congested in the morning sometimes. Not every morning. Sometimes I'll go a week where it doesn't happen at all, but I took one. I'm negative as well, but I'm going to make sure he tests maybe one more time. We'll see. I don't know if he's going to agree to do that, but for the most part, I am, masking around home. I'm in my room. Air purifier's running, so all is fine here. Let's get into today's update. We do have quite a few things to get through. First off, this is being revealed in the UK. Well, England to be precise. In 2023, 14,000 teachers call in sick every day. Yeah, I'm going to repeat that again. 14,000 teachers were calling in sick every day. Concerns that absent crisis provoked by a pandemic continues to disrupt learning. Well, yeah, there's a lot of reasons. People are constantly getting sick. And when people constantly get sick, guess what happens? Many things happen. One, teachers can get sick too. They're not immune to the viruses that your child brings into the classroom. Not at all. Something else that can happen is if there's a lot of kids that are currently sick, maybe some teachers want to play it safe. Say, I don't feel like going in today. You're sick. And then long COVID. I mean, there's just a whole array of different reasons. Probably some that I am not even mentioning. Then we come over to this story, and this is something that was first made aware of yesterday in the United States. There was H5N1 detected in a pig in Oregon, and, well, here's the deal with that. It now has become 2 pigs. Yes, a second pig has tested positive, and we're waiting results on a third one. Now, I'm going to be flat out honest with you. I am no expert when it comes to the spread of, new viruses, when a new virus is about to spread to a different species. But I have read several people who are saying that now that it's being detected in pigs, and now maybe a second pig, they're saying that is a big step for H5N1, and that is a very concerning step, and it's something we need to take very serious and monitor. So, H5N1, as I've been saying, it's evolving, and now that it's first time in a pig, it represents that virus could be getting more smart. Now, so far, the good news is, when it comes to human cases in the United States in this year, this is important to point out. I'm sure someone's going to tell me down below that it's important to mention this, and it is. There have been no deaths of H5N1 in the United States. But, again, this virus hasn't spread to a lot of people. In Washington State, there have been 5 human cases, and it says known exposure is from poultry animals, farms. So, again, it is worth noting here that there have been no deaths, but there have been few cases in humans. What's going to happen when we start getting dozens or maybe hundreds of cases? Well, only time will tell. We can only hope for the best. Moving on now to Canada. Mumps and measles on the rise in the region. I believe this is in the area of London, Canada, because it says CTV News London. It says mumps and measles on the rise in the region. Travel and vaccine hesitancy to blame. So, yeah, that is not good. And now moving on to this. This is something I found. Calgary in Canada. Alberta's fall COVID-19 surge has arrived, and hospitals are feeling it. 98 have died due to the illness since the end of August, compared to just one flu death. Yeah, 98 COVID deaths, one flu death. Get the picture here? COVID can be worse than flu, and it's causing more deaths than flu, but a reminder, COVID's hitting everybody differently. Some people get next to none symptoms, which is called asymptomatic if you have no symptoms. Some people, they could be perfectly healthy, and COVID really takes them down. Then they go on to develop long COVID. Some people don't get long COVID. Some people get in the hospital. I mean, it hits every person different. Moving on to this, and for some people, it's exactly the same as the flu. I mean, again, it hits every person different. Alright, moving on to a small poll I conducted yesterday. Do you know someone who stopped taking COVID seriously and is now dealing with long COVID? And it was only 150 votes. We'll probably have some polls that are bigger down the line. I can already think of something else I'm probably going to be asking within the next couple of days. But anywho, 66.7% said yes, 33.3% said no. So, yeah. The majority said yes, they know someone who stopped taking COVID seriously, and guess what? They are now going on to deal with long COVID because they got infected. In the UK, now we only got one thing here. I'm going to hit refresh again, and it looks to me like we only got one update out of the UK, and that was for cases. 207 less cases. They dropped by 207, so that drop, not as big. Weekly cases. 2,932, and you can see here on the chart they are dropping once again, but at some point they will start to rise once again, probably as we get closer to the holidays. I don't know. Someone let me know in the comments down below. Is Halloween a big thing in the UK? Do you do trick-or-treating? Do you celebrate it? I'm assuming you do celebrate it, but is it a big deal like it is here in the United States? Take a look at this now. We're going to take a look at the allergy pollen levels, and I think we're going to be putting this into hibernation pretty soon, because look at it. It's really starting to go more and more green, meaning less areas are dealing with pollen. So I think maybe next week will be the week that we put this to sleep until I start seeing this map light up once again. Just a few places of concern down in the south, and just a few places of concern in Texas as well. And one of the reasons why a lot of the United States is in the green is not because the growing season is ending, which that is a big factor. It's also because of how dry things are. So a lot of the stuff that's on the ground, like grass, it's really dying. I know here in the Northeast, it's just so dry. Everyone's lawn is starting to turn brown. More on that in just a moment. Taking a look now at the air qualities around the United States, if this comes up. It froze up for me earlier. And let's see what we get here. And you're going to see that there are some areas that are dealing with air quality issues. There are some areas that are dealing with some poor air qualities on the West Coast. And the rest of the country is not terrible. Some yellow areas in the Northeast. And again, this could change at any given point in time if we see any wildfires pop up. With how dry it is and with how windy it is in the Northeast today, wouldn't surprise me if a wildfire or two did crop up today. Want to learn more about the climate and weather? You can do that over on my other account on X and on YouTube. X is Climate Data Report. Blue Sky is Climate Data Report. And of course, you can go over to my weather channel that I have here on YouTube. Climate Data Report. I did post a video today on some news out of Spain and a typhoon that's coming for Taiwan. And of course, the forecast for the United States. Yeah. The death toll in Spain, it continues to go up. And in fact, it's gone even higher than when I did that video. I believe it's over 150 now from flash flooding. Yeah, truly not a good thing. Something else that's not a good thing. Now, over 800 EMS calls in Philadelphia. Okay, 801. That's just one over 800. But What I'm seeing today is deeply concerning to me. I've been keeping my eyes on CAD today, which is computer aided dispatch, and I've been seeing just some bad things in the surrounding counties of Philadelphia. In Montgomery and Chester County, those are the two counties I monitor. I could also monitor Delaware County. Their CAD system is not a list like this. Their CAD system is a little more difficult. It does list the calls, but Bucks County, Pennsylvania, there is no CAD system. And you go out to Lancaster, it just says call, call, call. So it doesn't give you the description. So take a look at this. This is from, again, 11:55 a.m., but take a look at the calls here. Stroke, stroke, sick person, sick person. And this one's Montgomery County, or excuse me, this one's Chester County. It was Chester County first. You get the idea here. Look how many sick person calls. Look how many stroke calls. Yeah, deeply concerning. And look at Montgomery County this morning. There were several respiratory emergencies, cardiac emergencies, but then the call volume slowed down a little bit, and there were less calls 2 hours ago. But look what happened when there were less calls. Yeah, take a look at this. Stroke, 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 sick person, heart problems. Let's go to another county. Cardiac emergency, stroke, cardiac emergency, cardiac arrest. You get it? The severity of these calls are not good. And a lot of these can be things that can happen post-COVID. Are all of them because of post-COVID? No, but I think the numbers of these severe calls is being increased because of people who may have had COVID. Let's do a live look in real quickly. And we're looking at Montgomery County first. And we do see cardiac emergency is listed twice right now. Luckily, we're not seeing cardiac arrest at the moment. And luckily, there are less calls now. Taking a look at what's going on in Chester County, Pennsylvania. Look at this. Respiratory difficulty, heart problems, back pain, seizures, heart problems, again, overdose, hemorrhaging, and emotional disorder. The heart problems, respiratory difficulties, strokes, cardiac arrest. Past few days, they've been popping up quite a bit. So I'm not happy to be reporting on that. And I did do a little back digging in the archives of listening to Center County. And boy, have they been busy lately. Center County, Pennsylvania, with a lot of things that could be post-COVID, and I've also heard the word COVID positive listed several times. That is one, there's not very many counties in the country, because I've done my research, that actually state what the calls are for, or actually state when someone's COVID positive. They do. I've heard COVID positive listed several times, and I've also heard of regions, like for example, there's a western portion of the county, this region, Phillipsburg area. I've heard several instances where they run out of ambulances. Not a good trend. But State College right now, that area, Penn State University, your transmission's still dropping at this point, but there's a humongous game there this weekend. It's the Penn State-Ohio State game. Game day's going to be there. Fox, big noon Saturday, and, well, several 100,000 people will likely show up. Some that will not even make it into the game. That could start increasing Pennsylvania more because they'll come from all corners of the state. And speaking of Pennsylvania increasing, eastern Pennsylvania is starting to see an increase in the Lehigh Valley, in Lehigh County, Allentown area, and northwest Montgomery County. One of the wastewater sites there is now orange. And you look here, you only see one wastewater site that is now decreasing. That means we're going to start seeing more wastewater sites flip. Maybe not next week, but coming soon in the near future. In Canada, the COVID viral activity level is now moderate. The viral activity level for flu A is not detected. Flu B is not detected. The viral activity level for RSV is moderate at this time. Taking a look at Walgreens this week, and the Walgreens, it started to flip. It's showing that the drop is really starting to slow down. The national positivity rate is 15.9%, 16.2% the prior week. It's down by 0.3%. It's either going to be flat next week or rise ever so slightly, would be my guess. And total number of tests, 4,675 versus 4,551. Taking a look at some wastewater now, and I want to show you national wastewater. Take a look here. It was dropping. Now that drop has really slowed, and they do put a little note here now. This is new. Did they always do this? Did I not notice it? This seems new to me. It says upward trend in the last 21 days and medium concentration. This is for COVID. So you can see here, it is, it's getting ready to rise again soon. RSV at this time, it says pathogen is seasonal and not in onset, although it's very low. It does look like overall it is trending up. And it does look like influenza A is starting to trend upward. Influenza B, not really yet. HMPV slightly. Norovirus, I'm concerned about this. Norovirus is really starting to take off. It says upward trend in the last 21 days and medium concentration. And now moving on, let's take a look. Let's take a look at some of the other regions. Let's look at the Midwest region. We can see here, Midwest, COVID is dropping. RSV, influenza A, influenza B, all not a big concern yet. HMPV, not a big concern. This is what I want you to see. Yet again, look at norovirus. It is just starting to skyrocket in the Midwest region. And let's just continue on here. In the Northeast, we can see here, COVID, it's not really dropping anymore. It's a wonky upward movement. But overall, it stopped dropping. And it is starting to rise once again. RSV, influenza A, influenza B, HMPV, not really an issue yet. Yet again, norovirus rapidly rising. Let's take a look now in the south. What's going on there? COVID, still low at this time, but already slowing off. Already slight signs that it may be starting to rise there. Yes, the south. The south did get hit hard with the summer wave. RSV, overall rising. Then there's this big drop. I don't know what that's about. So RSV is not really in its seasonal onset yet, and they say that. So influenza A has dropped. Influenza B is low. HMPV is low. Yet again, there's norovirus. It's rising. Now let's go to the West Coast, and I want to show you this. On the West Coast, COVID is listed medium at this time, and yeah, West Coast got hit really hard in the summertime. Already the West Coast may be on its early stages of starting to rise. RSV is low, trying to rise. Influenza A is low, trying to rise. Influenza B is low. HMPV, a little bit of a rise. It's extremely low, but medium norovirus. And take a look. It says no trend in the last 21 days, but yet you see this chart here, and it is starting to rise. All right, one last wastewater site I wanted to show you. As we were just talking about Pennsylvania, look at Harrisburg. Harrisburg, Pennsylvania is starting to see a rise. And you know what? To be fair, matter of fact, let's continue on and go out to the west for a second, because I don't like it when I talk so much about the east and not enough about the west. And well, actually, we do have a few more things for the west. I think we have Washington, which came in today. Santa Cruz, California. Here's one we haven't clicked on in a really long time. Medium COVID. And look at this. It says no trend, but look at the chart. It is starting to rise. I'm just seeing this the same time as you are. Just randomly clicked on a site here, and we can see that respiratory RSV is starting to rise, and influenza A is starting to rise. Influenza B is low. HMPV is low. Norovirus is medium at this time. Sometimes I just do unplanned things when it comes to wastewater and just randomly click on sites. All right, in the last update from the CDC, KP 3.1.1 was at 57%, XEC is at 17%. All right, now let's pause from my browser and take a look at some data that CJS 83172 gave us yesterday. And first off, some daily weekday reporting states. Florida, 258 new cases. New Jersey, 357 new cases and 1 new death. Weekly reporting states. Arizona, 1,490 new cases and 22 new deaths, all but one of which were from the past 3 weeks. Colorado, 239 new positive tests, a 6.6% test case positivity rate, and 19 CDC reported deaths. That was, I think, the other dashboard I wanted to look at out west, although I think we're going to look at Washington's dashboard as well. Indiana, 882 new cases and 9 new deaths. And New Mexico, 550 new cases and 6 CDC reported deaths. Nevada, 342 new cases. Oregon, 257 new positive tests and a test case positivity rate of 4% this week. And you guessed it, 19 deaths. Yep, more deaths. South Dakota had more deaths as well. Plus 261 new cases, and those new deaths were 7. Tennessee, 1,529 new cases and 17 new deaths. Washington, 24 state reported deaths. All right, back to the dashboards now. Taking a look at, let's look at this real quickly. We can see here, epidemic status is likely growing in Georgia. It is also growing in Arkansas, Tennessee, Kentucky, Ohio, and up in Michigan and in New York. And speaking of Ohio, stick around just a couple minutes. We are going to look at Ohio first, New York, and New Jersey. New Jersey being first. And hospitalizations in New Jersey for today 191. They're still dropping, but 67 out of 70 hospitals reported, 5 people on a ventilator. And can we get the ICU number? Sometimes this dashboard really freezes up. 21 people in the ICU, and discharges at this time show, if it ever comes up, 37 discharges. Taking a look at New York State, 688 people tested positive on the most recent update. That is still a decrease from last week, so still going in the right direction there, and hospitalizations are still going in the right direction as well. 539 hospitalized and 69 people in the ICU. Alright, that update from Ohio, and it's a not so good update. They're on the flipping coin. So in other words, the coin is flipping now, because they were dropping. Now this week, they are starting to rise. And here's the last 3 weeks' numbers. 2,874, 2,751, and this week for cases, 2,779. A slight rise, which, who knows, that may turn into a bigger rise next week. And hospitalizations, slight rise there, 116. Slight rise in the ICU, 7. And believe it or not, after reporting 18 deaths on the last update, this go around they went up to 29. Taking a look at Colorado, influenza hospital admission count, that's up by 4 to 8. COVID-19, 69, that's actually down by 21. RSV down by 4, that's actually just 2 in the hospital. And it looks like here the positivity rate for COVID is down to 6.64%, up slightly for influenza at 3.59%, and RSV is just 0.3% at this time. Taking a look at Washington's dashboard here, we see percentage of emergency department visits for COVID, just 1%. The number of ICU beds occupied is down by 5, just 19. Alrighty, folks, that does it for the Thursday edition of the Virus Update. We will have another Virus Update again tomorrow. I know this was a long update today, but there were a lot of things that I wanted to get through, and I owed you a better update. Yesterday was an absolute horrible update, in my opinion. I was not pleased with it, and there were a lot of things that I wanted to point out today. But a quick reminder, today's Halloween. Please celebrate Halloween safely. Do whatever you can to keep yourself safe. Alrighty, folks, if you enjoyed this video, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, and of course, leave your comments down below. I'll see you all again next time, which hopefully will be tomorrow as scheduled. Until I see you again next time, stay safe, have a fantastic Halloween day, and thanks for watching.